Oh, we got the call. We got the signal recording in progress.
Yeah, it's official.
Yeah. Oh man. So last time we got together, this was a great topic. We ended up talking a little bit about like youth sports, high school and stuff, because you've worked with a lot of high schools. But
Sure.
stuff has changed in your life since last time we talked. You've gotten deeper and deeper into ART. You're really good at what you do. And but you've worked with more and more with Division I athletes at Kansas State University, as you're based in Manhattan there. And now, I mean, a lot of those players are going pro, right?
Yeah, have been fortunate to the guys at K-State that I have worked with. A lot of them have been some of their studs. So, team captains and guys that are getting invited to the combine. And, I think there's three guys in the league right now that I've worked with in the NFL. And there should be probably another three this coming spring that are in the NFL. And I don't think I'd been to the Olympic trials with track and field the last time we talked. I think that was right before that. And so, yeah, I had some cool opportunities, very fortunate and blessed to have had that. But what it does is it makes you get better. It's like, if you're going to be working with guys, it's like, you got to be able to deliver. Dr. Moreau, who worked with Team USA, had a comment that I thought was good. And he said, if you're going to work with an athlete, you better have the tools that they need. And so, obviously ART is a big part of, what I do, and have taken a lot of new coursework with that. So.
Yeah, dude, I'm fascinated by the ART stuff that you've been doing. Because it's a method that has gotten more and more popular around rehab circles, around athlete management over a couple of decades, right?
Yeah.
But it's like, what's that been like? What have you been learning recently in ART?
Well, I think ART is utilized in every football setting in the professional level, every baseball team. All the Olympic athletes have, accessibility to an ART provider. I think I heard, and this is somewhat of a rumor, but I heard that either all or nearly all of the Big Ten colleges have ART providers on staff, just because of the success rates that they see in treating soft tissue and repetitive injuries. ART at its basics is kind of a diagnostic protocol and a treatment, kind of all lumped together. And so it's incredibly specific. It's incredibly effective. But the specificity that you can utilize in treating soft tissue injuries is different than any other manual or soft tissue treatment option that I've seen. And so, they have 700 protocols plus to treat tissue in the body, whether that is nerve or muscles or joints. And then a lot of their new level 2 stuff, which I probably started right before we spoke last time, and have since kind of completed with them, is talking about treating the borders or the boundaries that tissues share. And so, your bicep runs under your deltoid. And so there's a interface where those two tissues have to move past each other. And if you have a restriction there, it's going to change movement patterns. It's going to change output. It's going to create pain in that area. And so a lot of their level 2 protocols is focused on addressing that interface or that border. So you're treating two tissues at once, trying to improve the relative motion between them. So the fun part is like things like tennis elbow are simple. We know what they are, but just because they're simple doesn't mean like they're incredibly easy to fix all the time. And so a lot of this level 2 stuff has made some of those more frustrating cases much more manageable, and the recovery times have decreased in the clinic. So always learning with them. I think, that's a benefit of being around providers that are passionate about improving. So.
Yeah, that's fascinating. I think it's amazing. What I love about ART is that you get deep into the tissues, but you do it with motion.
Right.
And so it's just like getting the body moving through its natural ranges of motion, helping improve that and getting full expression of a range of motion, helping to release those tissues, improve that relationship with him. So, and you got the strongest hands ever since
Yeah,
you're such a manual provider, right?
yeah. If my body was proportional to my hand strength, I'd be just ripped out of my mind. So no, but I think that, and it's interesting in your sphere of influence and your work kind of environment, you see repetitive injuries all the time.
Yeah.
I mean, that's a lot of what you see. And so I think repetitive injury is something that's becoming increasingly more studied. Would you say that's a pretty high percentage of the overall injuries that you see with the badminton team or with the academy?
Yeah. Yeah. In general, like across the board, our injuries have come down. Our significant injuries have come down in the last year and a half. But yeah, the people who are getting injured have been the same people. It's repetitive injuries for those people. But a lot of what we're really trying to improve at is our load management and our communication with players. Like people need to, and this isn't just for our players, this is for people worldwide. Like people need to know that it doesn't have to be normal to live with pain. If you get, and pain is a lagging indicator. Like if you're starting to feel stiff or like restricted, and that's usually a precursor to feeling pain, and so, or if you're just feeling like, oh man, I'm just feeling beat up, like that doesn't mean you should just go and push all out.
Yeah, I think that's a
So
really good point. Repetitive injury, by the time you have pain, it's obvious. It's overuse. It's, oh, we've been doing this too much or your volume's too high. But a lot of what I talk with, some of the more elite athletes, because they're so in tune with how they feel, is, well, here's an example. I had a tight end from K-State that came in and said, Doc, when I come off my route and I cut left, I'm explosive. I feel fast and it's smooth. And when I come off my stem and I cut right, running a route, it doesn't hurt, but I feel slow and it doesn't feel fluid. And I just feel like I'm sticky. And so we start working him, and the leg that he is planning on, we find some restriction in the foot and in between some of the muscle tendons and structures down there. He just doesn't have, or he didn't have the appropriate, movement of the tissue or the relative motion in between those structures. And so we treated that one time. He went and practiced the next day, came back 2 days later. He goes, it's better, it's gone. And so, I think he was getting, in that specific case, he's getting overuse of tendons and tissue that's creating inflammation. It's creating kind of a restriction or a scar tissue buildup in between those structures. And if it's left long enough, then it becomes, painful or hypoxic, and then it's really impacting performance. And so, when we're talking about management of the body in the office, I tell people their focus isn't on pain anymore. It's on recovery and it's on performance. And if one of those two is off, you need to make a note of what is going on or what is different side to side. I think that's, from a clinical standpoint on my side, if that pairs well with load management, which is the world that you live in, I think then you have a huge impact on these athletes. But oftentimes one or both of those sides of the coin are lacking and they're just ticking time bombs. So
that's fascinating because there's like the example, that tight end you're working with, there's no pain, but he doesn't feel normal. Something's off in his game. Like cutting to one side is fine, cutting the other side isn't fine. And that's what's amazing, is like, okay, your body's smart. And whenever something isn't firing 100%, it will like automatically down regulate your ability to really stress those tissues. So it's like a nervous system down regulation. It's like, oh, I'm not going to let you cut full power
right
to the right because there's something going on your left leg that needs to be addressed. And that's a signal that a smart athlete was smart enough to reach out to you, like, I don't feel right. Like, can you check and see if there's something going on? So that's
Yeah.
fascinating. That just kind of comes back to the nervous system, right?
Yeah. And I think we've just been conditioned across the board to be like, if I'm not in pain, nothing's wrong. And there's tons of studies that show by the time that we are in pain, tissue is operating at roughly 40% of its capacity. And
Wow.
so from an injury standpoint, it's like you've had dysfunction, or this tight end has been struggling all season to go to the right, but he's had no pain. That tissue damage is already occurring. It's just not at the level that it's creating a stimuli to the brain saying, hey, we've got pain here now. So, and this is kind of a different topic, but the reverse is true as well. Oh, I'm 80%. I have no pain. I must be better. And they start loading tissue and then they get re-injured. It's like sometimes metrics that aren't subjective have to be utilized, to gauge if an athlete's ready to come back. Maybe their movement pattern still looks a little wonky, and that's an indication enough to just hold them for a little while. So, but back to your point about the nervous system, it's like his nervous system, that tight end's nervous system, is sending input that is altered from that tissue. So that tissue's damaged. The nerve signals that are going to the brain and spinal cord are different in tissue that's irritated. And so the brain calculates all that and the output's different. So I guarantee if we had a clock on that guy, he's much faster going left than he was right because he felt slow. And to your point, that's the brain down regulating that. It's changing that and say, we're going to stay off of that tissue so that it doesn't get worse.
Mm-hmm. That's fascinating. I mean, like in your practice, being in sports chiropractic, and I think it's beyond just chiropractic. Since you're in the ART field, you're a legit sports rehab professional, and even just performance maintenance. I would say, like you can catch stuff before it's a problem, before a player is removed from play, before the average person who's listening to this and wanting to like better themselves, like before you have something that debilitates you from doing or being who you want to be, you're able to catch those things. But being a professional it starts from the central nervous system, the brain and spinal cord, and everything branches out from there. Like, how does that help you see movement differently? How does that affect the way that you approach rehab?
Well, that's a really good question. I think the first thing that comes to my mind is, while problems often have simple solutions or components to them, the problem itself is incredibly complex. Like
Yeah.
the solution may be easy, but the problem itself is multifactorial, right? There's different things that are contributing to that: tissue health, nervous system integration, whether that's movement control or sensory input, whatever that may be. And so I think the obvious is when you have an injury, you have to look at all that stuff. The piece that I've seen with some of these elite athletes is that fatigue of that is sneaky. If their nutrition is trash, if their recovery is low, or their workout volume and load is high, one of the two in that scenario. If their mental stress is high, there's things that are going to create CNS fatigue, and that fatigue is going to impact the body as a whole performance-wise. Tissue quality, movement efficiency, power output, all of those things can be impacted. And I think the really cool thing that I saw presented to me, and I can't find the study, I've looked, but it was presented in a study, or in a seminar rather. A doc was talking about delayed onset muscle soreness, and forever and ever that's been understood as just damage to the muscle and the metabolic changes that are there. But this study showed that some of that soreness could be nervous system damage or fatigue. And so locally in the muscle is the nerve fibers getting sore basically, and creating some of that exacerbated soreness with DOMS several days later. I think more research needs to be done on that, but at least they're looking at the entire impact of the CNS. I think the fatigue factor is huge, and that is something that is missed in a lot of the athletes. I'm sure that's something that you see all the time. Highly competitive athletes, high training volume. So
yeah, like me, like being in the badminton world, it's very high training volume, very high impact. And with any professional sport, you're kind of playing with the nice edge. You know, how far can you push yourself without getting hurt? But if you like don't train enough, like if you're too careful, then you're not going to be, you know, a champion. So you're pushing how far can I go without falling over the edge. And so it's a challenge of like, yes, you have to be smart about your load management, which we're trying to leverage objective data. Like many of our top players, we're using Whoop, and we're really leveraging sleep and HRV to see how ready they are to train every day, to see how taxed is the CNS, because HRV can be a really significant sign of how ready they are. Like if your CNS is super fatigued, then your HRV is going to tank. So trying to leverage things like that, but you know, even prioritizing sleep for all of our players, like if your sleep debt is high, or you're not getting a certain baseline, then we can't expect you to have any accuracy or have any ability to take on significant load multiple days in a row. Maybe 1 or 2 days you can manage it, but then you're going to have to be off or have significantly less load. So we're trying to manage these things, because whenever we see players getting under recovered or significantly taxed from very high intensity, like repetitive, high impact movements, or, you know, really high muscle recruitment type movements, we find that they'll get little niggle stiffness, stuff that keeps them from playing their best, decreased ability to train, or significant mental fatigue. They just can't mentally push themselves. They're not motivated anymore, because they're just not fresh.
I think the mental component of that is been the most striking thing that I've seen with these athletes. It's not, I mean, they come in beat up every once in a while, and that's okay. I mean, they're aware of that. You're managing that. That's something that playing sports often creates, even if they're not in a CNS deficit. But the mental thing, I've seen athletes a couple of times, they just come in, they look defeated. And it's somebody that's just, you know, number one in the world, or, you know, whatever it is. And it's like, whoa. You need to eat a lot and push calories, and you need to get some sleep and detrain for a couple of days. And, you know, try and get some of the mental component back on that. I think that's a very sneaky sign for people, and it's often missed. Oh, I'm just having a down day, or I'm having a rough week, stressful week. And it's like, no, you can, if you coach these athletes, if you work with these athletes, you can tell when they have a down week, and then when they're just shot, you know?
Yeah, it's fascinating. Like whenever you're really trying to optimize your health for anybody, it's true. You kind of have to look at everything big picture, because stress is cumulative. It comes from every direction.
Right.
And so if you're trying to be your best, if your nutrition's off or your sleep is off, that's going to affect your ability to perform at whatever you do. If your load is too high, it might mess up a lot of other things. If your emotional stress is super high from lifestyle circumstances, then that can mess up your ability to perform. It can mess up your nutrition choices, it can mess up your sleep. Everything's interconnected. We're a system of systems, and
you treat the person,
so
you
stuff doesn't function apart from one another. Yeah. So
yeah, it's 100% true. And I think in the training, strength training and coaching industry, it's missed. In the healthcare field, it's missed. We take a incredibly complex problem and we offer simple solutions. And a lot of times that works, but we ignore some of the pieces that are contributing to that. So,
yeah. What's some stuff that you're really loving, what you're learning in your practice, or as you get deeper into ART?
I've really started to love challenging cases. I mean, I've always enjoyed that, but it's like you want to fix stuff that maybe hasn't been able to be fixed, right? And so I've had some cases that are way out there lately, and that's always fun to kind of put your detective hat on and start finding clues. Um, but something that this fall that's really been, I don't know, enjoyable or refreshing is the number of athletes that we're working on, that are really focusing on exactly what you and I are talking about. How can I help prevent injury? How can I help them perform, and how can I help them recover? And the fun part for me is that I feel like I'm fully utilizing my skill set, not just from a treatment standpoint, but from an education standpoint. It's like, how can you help that person understand their body better? How can they make better nutrition, application to support their goals? How can we change their sleep patterns? How can we decrease their mental stress on that and strain? And I think part of that passion has honestly stemmed out of COVID. Everybody's mental stuff went through the roof. Their training volume was different. And so it's forced me in some ways to adapt. And it's probably taken me a little, bit of time to kind of get used to discussing some of that with the normal patients. And that's kind of carried over into the more athletic population that I work with. And, but it's been rewarding because you come in, like I had a patient today, last week, she's been fighting chronic stuff for 2 years and high dose pain medication. And she's only 39. And it's kind of sad, right? At 39, you shouldn't be fighting this. And the frustrating thing is on the imaging, she doesn't have anything major wrong. And so we've started giving her some exercise, and we've given her some treatment, obviously, in the office, and doing some manipulation adjusting and doing some ART. But I made a recommendation to her the other day because she's never outside, to start supplementing vitamin D. And that was 7 days ago. And she came in and she's a completely different person today. And I told her, I said, I don't think it has anything to do with treatment that I did. I think it's that we found a nutrient that you've been severely deficient in a long time. And that's just rewarding when you're able to help them in a variety of ways. So that's what's got me fired up and getting out of bed in the morning lately. This fall, working with some of the football athletes around the area and for the university was fun. But that's just, it's incredibly taxing on them, and it's taxing on me. It's extra hours in the office. And so in some ways, I'm happy that I get a little reprieve from that for a couple months. So.
Yeah, man. Sounds like you're being challenged. To look at the whole picture of a client is challenging, because that challenges you to upgrade your own expertise. Like, oh, I'm not just a chiropractic doctor. I'm also need to think about nutrition. I also need to think about their sleep. Like someone comes in, they're beat up. Your first question may not be like, when did the pain start? It might be like, how's your sleep?
Right. And I think in some ways, anybody that works in a health field, whether that's training like what you're doing, or medical doctor, PT, chiro, it's like, if you're going to be the best that you can be and provide the best, results for your patient or athlete, there's some overlap with this stuff. It's like, and we get pigeonholed. We want to focus on, for chiropractors, we want to focus just on adjusting. And I think we should own manipulation. Like I fully believe that. But at the same time, if all I want to do is adjust patient, I'm never going to help that gal that was vitamin D deficient, like to the full extent that I could. And so, if you only focus on good programming, which I know you do good programming, but if you only focus on that and you ignore their mental strain or their nutrition or, their player load that their coach is putting on them, then you're only going to help them to a certain extent, and they're probably going to be at risk for, injury on that. So I think that's just something that's missed. And we've got to figure out a way to start breaking that mold a little bit. So.
Yeah, this is fascinating stuff, man. Crazy. It's we're always learning. We're always trying to get better at what we do. And I feel like I've learned some good things from you today. It's just like talking about, some of the initial indicators that we see in a player that shows that their readiness is down. So that just takes truly being a fully engaged coach, trainer, friend, doctor, provider, whatever that is. Like, if you're actively observing the person you're with as they're trying to perform, you can see if they're something's off. But it's also like a call to the athlete to like let people know when something's off. So
Yeah. Yeah. You got to break the stigma of it's a good thing to be aware of how your body's functioning. Now, you don't want every nick and scuff to be a major injury that you're sitting out 2 weeks. That's not what I'm advocating for. But, Dr. Moreau said something when I was just graduating from Cleveland that really has stuck with me. And he said, some of the patients that you will see day one will be there the rest of your career. And they may outlive you or you may outlive them, but they're going to be there your whole life. And if you knew a patient in your office was going to be there for the next 30 years and you were going to have a relationship with them as a friend almost level, or at least more than just doctor patient, getting to know that person, it's like you're going to want to try and help them, to the fullest extent that you can. And I think that mindset should be applied to the athletes that we work with. It's like if this athlete is going to become someone that I'm spending a decent amount of time around for the next 3 years, then I want to help them beyond giving them good strength cues or programming. It's like I want to help them perform in a variety of ways. So I think, that's something you do really well. It's something that I think we both try and get better at, and just keep figuring out different ways to apply it.
yeah, dude. So moving forward, like what are your plans like this year? What are you trying to level up in this year?
Well, I'm finishing my sports diplomate in April, I'm testing to finish it in April. Hopefully it's done. And I've been working on that since January 2020, so 3 years now. I'm really excited to get that done. That course has made me more proficient at treating athletes specifically, and there's hundreds of hours of coursework that goes into it. There's several hundred hours that has to go into outside clinic experience, and have to write a research article. And there's just been a bunch of work that's gone into it. So I'm excited to check that off. And honestly, getting that done and accomplishing that, I'm excited to start taking some new stuff. I want to do some different rehab courses this year. Obviously, I want to continue to do some ART courses. So when I have the big one off the table, it frees me up to do more stuff. And I'm sure my wife will love going along to these seminars, whether it's Colorado or whatever. It's just kind of a couple days away. So she's always excited when I want to learn, because usually, she's with me and she doesn't have to go sit in class. She can go do whatever she wants.
Nice.
How about you? You got some travel coming up?
Yeah. Be traveling to the UK for the All England badminton tournament. So it's a big tournament in badminton world. And and I'll be dropping it on the US. And so, but things I'm trying to really develop and level up in this year is just continually trying to serve people in big picture. Like, yes, I got strength conditioning on lockdown, but I've continually been trying to level myself up in the way I see movement as a movement specialist, to assess and be able to have, like, whether it's rehab or even just like daily maintenance, things that can really help move the needle forward for those athletes with what I can do within my scope of practice. And so, like with the athletes I'm working with, major things trying to help them improve in is really just their recovery behaviors, their lifestyle outside of their sport. Improving sleep, improving your daily maintenance as far as like owning your own mobility, working on that every day. And kind of understanding whenever you're ready to really push and when you should, or when you're making a conscious decision to really push hard to increase your level of performance, or whenever you need to, do maintenance in order to help yourself perform well consistently. So, of course, I'm taking right now is more on blood work, just trying to better understand labs whenever I get them, so that as much as I can within my practice. I know when I need to refer out. I know when I can see signs of something going on, or like, whenever I can see that there's signs of significant overload, whenever we don't want that much overload, so it's trying to get regular blood work with athletes I'm working with. So it's upgrading the overall service. And I'm really excited about this year, just like growing the number of athletes that I work with, not just within one specific sport, but multiple sports or multiple athletes around the world, being able to support them remotely with a high quality of service.
Well, you definitely deliver on it. So I wouldn't be surprised if you get more than you can chew. That seems to happen.
Yeah, it does. Yeah.
Yeah,
So
which is good.
I need
Which is good.
yeah. Yeah. So I think it's going to be there's probably going to be a tipping point where it's like, yeah, can I get some more coaches to work with me? Who wants to work with me? But
that is where I am at in practice. We've been blessed with another, we have 3 really good doctors, including myself, on staff, but it's like the need is greater than what 3 people can do. And
right.
Is a good problem to have, but it also is, I don't know, it makes you want to make sure that your tools are sharpened and that you're ready to go to work, that you're continually learning and trying to be prepared to help beyond what you already are. And obviously you want to recruit people that are smarter than you and can bring different things to the table. And so that's where I think we're both at. And so hopefully that all that can start falling into place really well. I'm excited to see, I've thought about this today, actually talking with one of our clinicians. I'm excited to see what 10 years looks like and to see the quality of clinicians that I have around me. Because if they're good, expecting, that's the expectation that they're good. It's like, I wonder how different my practice style and my, things that I've learned basically over the next decade will be when I'm 40 something, That's exciting to think about, micro versus macro view on that. But
yeah, man, let's keep leveling up. Let's keep working at it. And whenever the world is trying to develop around us, I appreciate that we both try to stay humble and teachable and bring other smart people around us.
I want to be the least smart guy in the room. I enjoy
try
that.
to be a highly skilled.
It just allows me to be a sponge. It's like, what can I absorb? So
that's amazing. Yeah, good minds around each other who are team players. That's a good environment to be around.
For sure.
All right, man. Well, this is good. I look forward to doing more of these. And if people want to learn more about this, have other deeper topics that they want to dive in on with me or Mitch, specifically on these topics around rehab or ART or chiropractic or load management, anything like that, give us a shot, leave us a comment, give us a rating, and it's gonna help us provide better information for you. So this is good, Mitch. We'll catch you on the next one.
All right. Thanks, man. Have a good one.